Welcome, everyone, to this episode of the Sunflower Palliative Care Podcast. This is a podcast exploring all aspects of children's palliative care from around the world. This is a podcast we started to engage and learn from each other and from all of our international colleagues in pediatric palliative care. We have formed a really big, amazing community from all around the world, and this is a way for us to stay connected. These podcasts are here so we can share ideas, learn from each other, inspire each other to continue to do this hard but amazing work. I'm Natasha Datu, a volunteer with Two Worlds Cancer Collaboration and a palliative care specialist at Connect Place Children's Hospice, as well as a pediatric oncologist at BC Children's Hospital in Vancouver, Canada. In 2023, the Sunflower Children's Network, alongside various other participants and supporters, started a leadership program that brings together young and inspiring healthcare professionals who are engaged and wanting to provide pediatric palliative care in South and Southeast Asia. Today is day 3 of our 4 podcasts, where I'm talking to some of our pediatric palliative care leadership program graduates and participants about some of the really incredible initiatives they have started in their home communities. So today we're talking to our third of 4 participants who will share his experience in the leadership program as well as his project. So I would like to introduce Dr. Shaidur Rahman, who works in Bangladesh. So welcome, Shaidur. Maybe you can introduce yourself to our audience.
Hello, I am Dr. Mohammad Shaidur Rahman, pediatric palliative care physician from Dhaka Medical College, Bangladesh.
Thanks, Shaidur. And Shaidur was one of our fellows who we trained in pediatric palliative care. So it's nice for me to catch up with you again. Thank you for joining us today. Shaidur, can you introduce yourself to our learners and maybe a little bit about your training in palliative care?
Okay, actually, I first completed my post graduation in pediatrics. After that, I go through some foundation course in pediatric palliative care. After that, I took a 1 year fellowship in pediatric palliative care in 2023, and it is a hybrid session. I trained both in online session and 2 months clinical rotation there in Hyderabad. So there are 3 colleagues from one is from Philippines, one is from Nepal, and I'm from Bangladesh. Graduated from this fellowship in 2003, and then I started working in Dhaka Medical College as a pediatric palliative care physician and tried to develop pediatric palliative care in Bangladesh day by day. Hope it will be successful very soon.
Thank you so much, Shaidur. Can you maybe tell us a little bit about why you wanted to participate in the Children's Palliative Care Leadership Program?
I want to explore actually the children's palliative care leadership in ways that include influence rather than authority, leading tasks as well as teams. That's why actually I want to participate in palliative care leadership program.
Great. It sounds like you want to have skills to advance pediatric palliative care in your country, not just provide it yourself. A big task and very inspiring. So, early on in the program, there was an in person workshop in Hyderabad where the leadership scholars and faculty gathered together in India last year. Can you tell us maybe a little bit about what was particularly memorable, what stuck with you during this program that you participated in person?
We met different scholars from different countries, and it changes my view. We have to celebrate every small win. We have to celebrate. I learned from the program, and I learned how to work like a girl, like connected by beat, and we have to actually lead by example, and how we can continue to nurture and grow every day. That's are the things I actually particularly memorable things that I learned from this leadership program that happened in Hyderabad.
Great. It sounds like it was quite inspiring and maybe gives you a little insight into how to build resilience and continue to do this work. And have you been able to do some of that since you've gone back to Bangladesh? Have you been able to use some of those memorable skills you picked up?
After come back, actually, there are so many obstacles during starting pediatric palliative care here. Actually, people are not, and the faculties are also not very familiar with pediatric palliative care things, and people actually thinks that only hemato-oncology patients require pediatric palliative care in my department. After I come back, I try to actually do some training in Dhaka Medical College, where they come to know that there are many situations where pediatric palliative care actually needed. And now I am able to give the pediatric palliative care service both in oncology and some non-oncology conditions also. That is the things. It starts very small way, but I think we can celebrate this small win that we started, and gradually we can grow, and our children will be benefited from it.
That's such a good point. Pediatric oncology patients absolutely need palliative care, but there are a whole group of other patients who are living with serious illness who also benefit from a palliative approach to care. And that is a common misconception all over the world. You describe it as small, but I think I think what you're doing is very big, but it does start with one patient, right? You see one patient in the nephrology or neurology ward and they learn about what you do, and then it inspires different doctors to ask you to be involved. So I think your approach of starting with one patient and allowing people to see the positive work is it's big actually. So that's amazing. Can
Mm.
you maybe tell us a little bit about what was surprising? What surprised you during the leadership program that you attended last year?
Previously don't think about the marginalized gain, but from the leadership program, I learned that inspired by shared vision that marginalized gain may be 1%, but this 1% will grow over time. So many of us are not become happy with the 1%, but previously you mentioned, Natasha, that is this one patient I see and make a difference in the life of this patient will impact our other peoples, that this way things are growing. So this marginalized gain maybe 1%, but I think it will grow over time.
That's great. That's actually really insightful of you. It's true. One patient can have a very big impact, especially marginalized patients, because they're often forgotten. So the impact of caring for one patient actually is quite big for you personally, but also for other people to understand the benefits of palliative care. I've learned that actually showing people the work that we do, not just telling them, actually can have a bigger impact when they see how we can help patients and families. So that is a beautiful thing you were surprised about and have been able to take back to your home country in Bangladesh. So we'll move a little bit to your project. Every leadership scholar has to develop and conduct a project. So can you tell us a little bit about your project, Shaidur?
You Actually, my project is to improving access to pediatric symptom management, engaging and educating healthcare practitioners to improve lives for children with serious illness in Bangladesh, which is actually funded by Sick Kids. And we are going to actually train four centers, that is Dhaka Medical College, Khulna Medical College, Rangpur Medical College, and Sylhet Medical College, both the doctors and the nurses about pediatric palliative care things. And it is gone in both ways, that is online training followed by in-person visit, and try to explore that what are the things going on there, because we train them and they are applying in this in their practice day-to-day patients care, and try to encourage them to do things day by day. You know that pediatric palliative care actually in Bangladesh mainly is a little flourished, and in mainly Dhaka based, that is the capital city of Bangladesh. But my project is now is to involve the periphery centers and spread the awareness of pediatric palliative care and make them engaged with the process of delivering pediatric palliative care service in different centers.
Wonderful. Thank you. So it sounds like your project is supported and funded by Sick Kids, which is a pediatric hospital in Toronto, Canada. And can you tell us a little bit about how the training will take place? Is it a manual? Is it in-person workshops? How are you planning on training the four centers?
Yes, it's really funded by Sikis, and along with technical helps we get from Two Walls Cancer Collaboration. And we first select the participants through an online survey from the different centers. We circulate it, and the people got registered. Then we give them a 6 weeks online training, and after that they have to give a assessment examination, and they need a pass mark on that. And after that, Dr. Spandan Araila from Kuwait, she visited Bangladesh on June, and we go to Dhaka Medical College and Sylhet, Khulna, and Rangpur Medical College in person, and we share our experience with them, and we also learn from them how the difficulties they are facing during delivering this service, or anything improved after our training in their daily patients management. These are the things we learn from them, and we learn also the barriers, what are the barriers, and what we can do for these. That is the things we got after our training process, and it will be followed by next another visit in 2025 by another person from abroad, pediatric physician, along with me, and there is another doctor in Bangladesh, that is Dr. Jannat. Will going to visit again the centers and keep them motivated them in the service in pediatric palliative care.
Wow, that's great. That's a big reach you're aiming for. So I applaud you for it's a lot of work. Can you tell me a little bit about the participants? Is it doctors, nurses, allied health? Because as we know, pediatric palliative care requires a lot of people to support, especially the bedside nurses. So who has been participating in your training so far?
In our training, actually, it's mainly doctors and nurses are of pediatrics department are attending. Along with that, some of pharmacists. They are less in number, but sisters and doctors are in a ratio like doctors and sisters are more able to get trained from this training process. Sisters, we try to engage more sisters, but in our country, sisters are not very much come forward to train. But this time, we train some of our sisters. That is, we train around 10 nurses from every centers. There are some centers like that. Our target was 10, but in some centers it decreases, like 6 nurses joined. But we are hopeful because they are now they disseminate the information to other nurses in their centers, and the nurses become also interested, show their interest in the training process. And when we go in person, then we found more nurses. They are joined in our workshops. 25, 30 nurses joined in nursing sessions in each institute. So that will a good reach of number we able to cover in in-person workshops. Maybe there are less in online sessions, but we can able to reach a more number in in-person workshops. That will be, I think, a success in our training process.
Absolutely. That's amazing that you have been able to recruit so many nurses because as we know, they are the most important in this work. They're the ones at the bedside seeing patients, seeing the suffering. So incredible work that you're doing. So Shaidur, can you explain to us a little bit about how you think that your project fits with your vision of children's palliative care for your country?
Okay, our vision is to transform care for children with complex conditions by improving access to essential pediatric palliative care. Through our project, we hope that 500 children and their families are directly benefited from this process, who are currently have no access to this type of care in Bangladesh. This estimate is based on training and empowering 50 multidisciplinary healthcare provider. We estimate that each trained healthcare provider will provide enhanced pediatric palliative care for at least 10 children per 6 months. So in that way, it can be 500 based on estimates from similar needs assessment in South Asia and other countries. The project is an innovative approach to building nurse and healthcare providers' capacity, which will greatly increase the number of trained pediatric palliative care nurses and healthcare providers, and who will be equipped to lead and become a champion in pediatric palliative care nursing and supporting further capacity building and training locally at each of their centers. When we trained the Rangpur centers, we also tell them you can cover the Rangpur region. There are other medical colleges there, so they can also come together and train the other healthcare providers nearer to their centers with the support. And this training is support from our local, regional, and international mentors. That is from Bangladesh and from India and Canada and some other countries. The project will actually, by this way, I think the healthcare providers are also collaborates and partners, but with the other international and local pulse, they have a potential opportunity to communicate with the other peoples and learn regularly and research also regularly about their works. I think we can collaborate in future activities to scale up this work.
Yes, as you said earlier on, your vision and hope sounds like to be able to disseminate the idea and approach to pediatric palliative care to Bangladesh as a country, not just to your hospital, which is very, very commendable. So you're doing a very good job at this big work. Can you share a little bit about some of the success you've had so far with your project?
We already trained our selected doctors and nurses, both in online and offline. And we also able to visit all the centers in person and gain experience from different healthcare providers. These are the main two success we already done. And in different centers, people are also now try to provide the service to the children with complex conditions. And there previously I found in different places that they are frequently referred the patients to the center, that is Dhaka Medical College, the center. But now they are trying to give the service in locally, because you know that at the end of life, it's not worthy to send the patients to a distance center, and patient may die in the on the way also. So this is gradually decreasing in number now. Referral numbers also decreasing, and the care is locally given now. So this is success, I think we able to do only on 3 centers also, but I think it is okay for this project, and gradually will be increase the numbers also.
That's great. That's a big success. And maybe can you tell us one thing as you've gone through this whole process that has surprised you?
One thing I found that people are very interested in online sessions, but when I found that they are less interested in applying day to day practice. They promises, but I think it's required time because it's a new thing. So their day to day practice needs actually, we have to inspire them also regularly in regular basis. In this way, this application will be improved also. And one thing also I find that is people are reluctant in time management also. That is when we go in person visit, time management I think is not so okay. They are reluctant in time management. So we have to reschedule these things during our local visits. Think if we are able to manage time properly and able to make them interest in applying pediatric palliative care services in their day-to-day practice, like I already trained the nurses about procedural pain, they can apply this in their day-to practice. And I found the sisters are very interested in regarding these things like procedural pain management. They are previously not known this, that there's something we have to do during to reduce the procedural pain, like these things. So and memory making like things. So these are the things make a meaningful impact on their service now, and I think we can able to make more changes day to day if we supervise them regularly. And one thing I forget to tell you, that we supervise in the way that we are already planned and implemented a monthly online eco session for the centers, so they are not getting disconnected from us. They are again joining monthly sessions, and they share their experiences in monthly basis, so we are get communicated with them, and that's where we are inspired them.
Thank you, Shaidur. Yes, it's a common theme, I think, with training programs where some people do well with the online but it's harder to do it in person because of time constraints, maybe lack of confidence, and other people find easier to do in person. So it's great you're actually doing both, where you visit all of these centers as well as the online training. Maybe before we close, could you maybe share with our listeners a patient story, or, a child that inspired you, where you saw the direct impact of palliative care, and what makes you want to continue on this work?
This story is about a child named Abu Arshad. Abu Arshad is 12 years old and he is suffering from AML, and he got referred from different centers to Dhaka Medical College. And when we received him, he is a very that is critical conditions. Through PPS, there is a palliative pediatric scoring system. We found that its life expectancy maybe that is 2 weeks. But the father is insisting us to recommend him to go to abroad or like other places where they can provide better service like these things. But the condition is very critical, and I counsel the father that it is not possible in the situation to travel the child. It will be very risky at that moment. And I surprisingly found that the father wants me to not to disclose the situation, that is disease the child is suffered from with a child. And there is a collusion, and I asked the father that, are you sure that your child not known the disease condition, what is he going through? Father says, I'm sure he is not know anything, and if he know, he cannot tolerate the news, the bad news. He cannot tolerate news. So I say that let's explore. Your child is not no. So I go to Abu Arshad and I asked Abu Arshad what happened to him, like these things questions. And Abu Arshad said that, doctor, I know what is my condition and I am suffered for cancer. And he requested me not to share these things with his father. If I share this with his father will be breakdown. That is his perception. But after that, I actually make a session with the father and with the Abu Arshad, and then again with father and Abu Arshad together, and try to disclose the news and what are the things we are planning. And these things all we described. And there is Abu Arshad's last wish was he wants to die during his prayer. And after the session, actually within 24 hours, the child's condition becomes very deteriorated, and we give the symptom management. But Abu Arshad's last wish was to die in prayer, and his father make it possible. During the praying, Abu Arshad died. So the father actually thanked us because before the sessions, the father is actually not come close to the child because conditions of the child is not tolerable for him because the situation is gradually deteriorating, and father is go here and there but not come close to the child. And after our counseling and sessions, he is able to hold the child and taking care that this 12 years old child, which is very usually not done because 12 years child is an adolescent, and he's very happy that we actually make these things possible and make the things pain free and symptom free. He thanked us that we actually make a very good memory for him, and he will be never regret that his child's last wish not fulfilled. This is touched me a lot. Every life is precious. There is a limit of care. What we say that there is limit of cure, but there is no limit of care. There's something we can do for the patients and their families always. And one thing is that pediatric palliative care actually is like what we say, that is a sugar in the milk. It increase the taste of the milk, but don't spoil the milk. So patients, that it's a hemato-oncological patients. So patients is actually the primary patients of the pediatric hemato-oncologist. But why we are there to for symptom management. That is very important for the child also. So from doctors and healthcare providers from different disciplines, always things that is sometimes we are stealing their patients, not like that actually. We are there to cover the symptoms. So in that way, if they think that we can provide more service to different patients, and in that way we help to ensure the quality of life and also quality of death of the patients.
Wow, thank you, Shaidur. I love that. There is a limit to cure, but no limit to care. That's really beautiful because this story you shared, without the palliative care team, that father may not have been able to be sitting and praying with his child as he died. That experience and what you team was able to provide will help that father in his bereavement as he has to live on without his child. So what a beautiful story, and thank you for sharing your ideas and approach to palliative care, which is really about caring, really about being human and caring for children and families. So I wanted to say thank you so much to Dr. Shaidur Shahag from Bangladesh for sharing his insight and his project, and we wish you all the best in this big endeavor. And thank you to all of our listeners for listening to this podcast and this episode of the Sunflower Palliative Care podcasts. We look forward to sharing future episodes in this series with you. These podcasts grew from the seed of an idea as we talked with our colleagues in the Sunflower Children's Network. The Sunflower Children's Network is an initiative of Two Worlds Cancer Collaboration, focusing specifically on children's palliative care needs. We hope to build a world where no child suffers from serious, life-threatening health-related suffering. To learn more or donate, please visit twoworldscancer.ca. Thanks for listening and see you next time.